5 myths about type 1 diabetes. If you or a loved one has been diagnosed with type 1 diabetes, you may have heard some common misconceptions. It's important to know the facts so that you can manage the condition and advocate for yourself or your loved one. Many people believe that type 1 and type 2 diabetes are pretty much the same. But the fact is, type 1 and type 2 diabetes are very different diseases. Type 1 diabetes is an autoimmune condition. The body fights the cells that make insulin, preventing insulin from being made. Type 2 diabetes is a metabolic disease. The body can make insulin but isn't able to use it effectively. Type 1 diabetes is managed through insulin and lifestyle changes. Type 2 diabetes can be managed through lifestyle changes, medication, and sometimes insulin. Some people mistakenly believe that type 1 diabetes can be prevented with a healthy lifestyle. But type 1 diabetes isn't caused by diet, activity level, or other habits. The exact cause of type 1 diabetes isn't known. However, certain genes increase a person's risk, and environmental factors may play a role too. It's important to know that people with type 1 diabetes didn't do anything wrong to cause their condition. It's commonly thought that type 1 diabetes only develops in children. However, over half of those diagnosed with type 1 diabetes are over 20 years old. Although it's most often diagnosed in adolescence, people of any age can be diagnosed with type 1 diabetes. Some people believe that only people with a family history of type 1 diabetes develop the condition. But the fact is, 90% of people with type 1 diabetes don't have a family history of the condition. Still, it's important to know that people with a family history of type 1 diabetes are at a higher risk of developing it. If you have a family history, look out for symptoms like having to pee more often, feeling very thirsty, extreme fatigue, or weight loss. Seeking medical care can help prevent complications. You may also consider type 1 diabetes screening for family members. It's a misconception that people with type 1 diabetes can't have carbs or sugar. But the fact is, those with type 1 diabetes can include carbs as part of a balanced diet. Someone living with type 1 diabetes has to understand how food, drinks, and other factors like stress and sleep affect their blood sugar and how much insulin they need. They may need to adjust their lifestyle to help manage their blood sugar. Understanding the facts about type 1 diabetes is an important step in helping you or the person you're supporting receive the best care possible.